Seems Russian trolls are being called out for their nefarious antics yet again. This time they're being blamed for a measles outbreak in Europe, according to US government-funded radio Free Europe Radio Liberty. According to their article, Russian trolls and bots are now fueling fear of vaccines among the public. It's claimed that cyber campaigns were used to distribute medical misinformation, to promote distrust in pharmaceutical companies and to spread the arguments of vaccine skeptics. Well, the piece then goes on to quote World Health Organization vaccine specialist Katrine Habersat, who doesn't put much stock in this link between trolls and the measles outbreak. She says there are a variety of factors at play and the increased incidence of the disease.
We actually don't know enough about the influence of misinformation available online upon vaccination intentions and behaviors. What we do know is that there is an element of echo chambers in this.
There might be lots of reasons why people don't take up vaccines. It may simply be that their access to healthcare services is limited. There may be cultural reasons, and people may also be getting incorrect information about whether vaccines are safe or not. It might not necessarily be correct to leap to any conclusions as to whether it's trolls or any other cause. What's really important is that people have access to information that can help them to make the right choice for them and their loved ones as to whether they proceed with the vaccination. I think that's the opportunity that all nations should seek to grasp, really, to have a healthcare system which is based on good empirical data about vaccine take-up, about the surveillance of the disease, because ultimately what we want to do is save people's lives, and that's the opportunity that countries have, rather than seeking to attribute blame elsewhere.
Criticism of inoculations does appear to be gaining ground with the general public in several countries. Hundreds of anti-vaccine activists demonstrated against a bill that would make it harder to opt out of measles vaccination in the US state of Washington, which is suffering its own outbreak of measles. And over the years, people in Germany, Poland and Italy have protested against compulsory immunisations. Bill Boerum, chair of the Northern California Healthcare Authority, says blaming foreign countries for falling vaccination rates is simply irresponsible.
For a long time, certainly in the United States, there has been a subculture that has resisted conventional medicine. And this is its greatest manifestation has been resistance to vaccines. It's all part of a popular movement, which is to resist authority. And it has appeal for people who may feel left out of the political process or disenfranchised from the economic system. What I have seen in a conference I attended, that if anything, the agenda of the Ministry of Health of the Russian Federation is to improve and enhance the health care of the population throughout the country. It's very scurrilous and irresponsible to accuse Russia or the Kremlin of promoting this kind of misinformation.